Hi there, in today's video we're actually going to demonstrate how to do an FMX on a Dexter mannequin using the paralleling technique. So let's go ahead and get started. So typically when you start taking your FMX, you want to start on the anterior teeth first and kind of be methodical about it, so that way you're maximizing your time. So you'll see that I have the anterior set up right here like so. The one thing that we mentioned in one of our other videos when we're attaching the sensor is that you want to make sure that it isn't too far down when we're doing a periapical, because we want to make sure that this is high enough up to get the apex of the root. So typically when we're doing an FMX, we're going to start by centering the film over a canine, then between the two central incisors, and then another canine, and then down on the bottom we're going to do the same thing. We're going to do a canine, we're going to do a central, and then we're going to do another canine. So we're going to go ahead and get started with the anterior canine first on the patient's right side. So you're going to kind of go in at an angle like this, okay? So if you just go in like this, you're going to be too close to the front part of the mouth, and then this part isn't going to be able to go inside of the patient's mouth. So when they bite down, it's going to torque it up towards this part of the tooth or part of the face, and then you're going to have too much vertical angulation errors, okay? So when we go in, we want to make sure that our ring is out towards the end of our bar, and then you're going to kind of go in like this, and then stand it upright, and then you're going to do a 2-point contact. You're going to seat it up on the palate, and then up on the incisal edge, and then you're going to have the patient bite down, okay? So that looks pretty good. Then you're going to slide the ring close to the patient's face without touching it, and then you're going to go ahead and line up your PID to where it is parallel with the ring. The big thing is you want to make sure that you line it up accurately, so that way you don't have any type of errors. This, I actually have my bag tied on a little too tight, so we're going to loosen it up so that way it doesn't want to sway or move on me. That's something that you want to make sure that you pay attention to as you do your placement and as you walk out of the room to do the exposure. You don't want to end up having any issues or problems with your PID moving as you go out of the room to do the exposure. Okay, so that's the canine. So then next we're going to go ahead and we're going to move over to the central. Okay, so again, you're going to go in at an angle like this, seat it up on the palate, up on the incisal surface of the teeth, and then you're going to have the patient bite down slowly and gently. The one thing is you do want to ask them to bite down very slowly and gently, because sometimes they have a tendency to bite down a little too fast. And when they do that, it can actually be more uncomfortable for them. So for the sake of saving time for the video, I'm not going to go ahead and place the PID for every single one. I just mostly want to show you packet placement. I'll end up doing another video where I actually go through and demonstrate differences in your packet placement, your vertical, your horizontal angulation, cone cutting, like how those errors are made and what they actually look like on the x-ray. Okay, so next we're going to go ahead and place this one on the upper left canine. So again, you're going to go in at an angle, you're going to seat it up on the palate, up on the incisal edge of the tooth, and then have the patient bite down, slide the ring in. Okay, so the only difference between a maxillary and a mandibular is all you have to do is flip it upside down. You don't have to do anything different with the way that this is set up currently. Now for this one, the big thing is that ideally you want to try and place it into the floor of the mouth, not on top of the tongue. Now, some people may have narrow mandibulars. They may have mandibular tori. So in that instance, you would want to place it on top of the patient's tongue because it's going to make it more comfortable for the patient. The only difference with that is you don't really want to say anything about the tongue to the patient, because people start doing really weird things as soon as you mention the tongue. The tongue kind of has a mind of its own. So then sometimes if you mention the tongue, it makes your packet placement a little bit more difficult for your patient. Okay, so now I'm going to go ahead and lift the tongue up out of the way. So with this one, again, I'm still angling it to go into the mouth. So we're going to go angling it like this. We're going to stand it upright, making sure that it's centered with the canine, and then we're going to have the patient bite down gently. All right, and so this is what your mandibular left canine would look like. And so the big thing is again, making sure that you're keeping your PID close, so that way it's very little movement and very little time that this has to spend in the patient's mouth. These can be very uncomfortable for some people, so you just want to make sure that you're maximizing the little bit of time that you're going in and out of the mouth. So now we're going to go ahead and do the centrals between, centering it between number 24 and number 25, and then we're going to have the patient bite down like so, making sure that it's centered. Okay, so that looks good. So next we're going to go ahead and we are going to do the last canine, and have the patient bite down after we center it, okay? The big thing is you don't want it angling down like this, because if you have it like that, you're gonna have a lot of vertical angulation errors, all right? So next we are going to do the bite wings. So ideally you would want to move from your anterior teeth to your bite wings and then all of your posterior PAs. The reason why we always start in the anterior area of the mouth is because it's more easily tolerable for the patient. And so if they have a strong gag reflex, we're not going to end up initiating that gag reflex by, starting all the way in the back of the mouth, because once they start gagging, sometimes it's difficult for them to stop. So with the bite wing, we're going to make sure that we place the sensor centered in the ring. So you're going to look at it just like so, okay? Now with these, packet placement is significant. So you're going to be doing a premolar and a molar bite wing. So your packet placement is going to be on the premolar, the distal of the canine. On the molar, it's going to be the distal of the second premolar. So you need to not only look at the mandibular, you need to look at the maxillary. Because remember, a bite wing is having the patient bite down to where you're seeing half of the upper and half of the lower teeth. So the crown or coronal portion of the teeth in the film. The bite wings are very good for detecting interproximal decay. Whereas a periapical film, that's good for determining whether or not there's any lesions in the bone or if the patient has any abscesses or any bony abnormalities. So again, with this one, you want to make sure that you get the patient's tongue out of the way. And normally the way that you do that is if we were doing this on a real patient, you would actually kind of dive in with this front corner and get it in between the tooth and the tongue, and then push this more towards the midline of the mouth. So the big thing also with this is making sure that you have it parallel. So you'll notice right here, if I angle it like this, that is not parallel with the premolars. If I angle it like this, that is not parallel with the premolars. If I place it like so, and it's almost as if that bite block is actually resting along the occlusal surface of the teeth, then you pretty much know that you have it in the proper horizontal angulation. All right, so I've got it far enough forward to get proper packet placement. I've got my horizontal angulation very good, and then when I have the patient bite down, I can check for vertical angulation. So if for some reason, when I have the patient bite down, if this was angling too far down or too far up, then my vertical angulation is going to be affected on the bite wing, and that's going to result in me either having too much of the upper or too much of the lower teeth in the film. So on a bite wing, you want it 50-50, so you want to make sure that you pay attention to that. So if that looks like it's not lining up correctly, then you would want to just go ahead and try and reposition it in the patient's mouth before you line up your PID and actually take the x-ray. So for this particular one, I'm going to go ahead and have the patient bite down all the way, making sure that the ring is close to the patient's face. And then I will again show you guys the PID placement for this, just since this is a different type of x-ray than the anterior PAs. So ideally you want to try and get this parallel to the ring, okay? So then the next film that we're actually going to be doing is going to be doing the molar bite wing. So again, we want to make sure that the front edge of the sensor is close to the distal of the second premolars, I should say, the maxillary and mandibular. Again, you want to make sure it's parallel. You don't want it like this, and you don't want it like this. So I would ideally look and see, is this resting up against the occlusal surface of those teeth? And then I'm going to go ahead and have the patient bite down, okay? All right, so that looks good. All right, so now we're gonna go ahead and do the bite wings on the patient's left side. So you'll need to go ahead and take that out. So when you're doing this on a real patient, you would have to take this out every single time, let the patient swallow, let them get acclimated to the environment, and then try and redo it over again. So with this one, all we do is we take it on this side and then we flip it over to do it on this side. If you were using phosphor plates, you would have to pay attention to where you're placing the dot, because the dot actually helps you with your mounting, okay? So again, we're gonna dive in with the front corner, so that way we can work that tongue out of our way, because on a bite wing, we do not want this sitting on top of the patient's tongue. So for the premolar, we wanna make sure it's far enough forward that we have the proper packet placement, the distal of the canine, making sure that our horizontal angulation is accurate, and then when we have the patient bite down, that the ring is actually kind of coming right out of the middle of the mouth, okay? And then the last bite wing that we're gonna do is gonna be the molars on this patient's left side. And so we're gonna place it like so, and then have the patient bite down, okay? So next we are moving on to our periapicals, okay? So with our periapicals, I actually have this one set up to where it's going to go into the patient's upper right and then the patient's lower left, Okay, now what we would have to do in order to do the upper left and the lower right is reposition the bite block and the ring, and I'll show you guys how to do that when we're ready to move on to that. So with this one, the way that we place the sensor on, again, because it's a periapical, is we want to make sure that this is going down towards the bottom, and then we're securing it tightly on these universal peel and stick bite blocks. Now there are different bite blocks on the market. There are some that actually have like a rubber band and it'll actually secure this onto the bite holder. Several different styles. I just chose to use these because they're less bulky and a little bit easier to do the demo with, okay? So with these, we're still going to have the same packet placement as we do for the Bitewings. So for our premolar, it's going to be distal of the canine, and then for our molar, it's going to be distal of the second premolar. Okay. So with this one, when you're doing the maxillary anteriors, what you want to make sure is that you go straight into the patient's mouth like so. If you just kind of go in all wonky, you're going to have to do a lot of movement once you get in the patient's mouth. And sometimes that can be uncomfortable, especially if you're like rubbing it up against the palate, okay? So again, I'm gonna show you. You basically go straight in, and then all you have to do for a premolar is angle it this way, or if you're doing a molar, you're gonna angle it back more that way. One of the other ways that you can actually look at this particular setup to make sure that you have this going on the right side of the patient's mouth is that, think about this if we were, I'm gonna take this sensor off for just a second. Think about this as if we were gonna hook a fish. So if we're gonna hook a fish, we want the inside of the hook to go into the patient's mouth, right? Because if I do it this way, if I was gonna put it over on this side of the patient's mouth, this is actually hooking on the outside of the patient's mouth. Do you see the metal bar over there? Excuse me. So with that, if this was a fish, they could actually kick out that hook and then you wouldn't catch the fish. So the big thing is making sure that this looks like it's a hook going inside of the patient's mouth. Okay, so I use that hooking the fish as an analogy to kind of help my students determine, are they using the correct setup for the correct side of the mouth? Okay, so now we're gonna go ahead and we're gonna go straight in, place it up, again, 2-point contact. We're gonna place it up on the palate, up on the premolar, and then we're gonna have the patient bite down, okay? So that's that for the premolar PA on the upper right. So now for the sake of showing you how the PID placement goes, we're gonna go ahead and place it just like so, okay? Good. All right, so next we would end up doing so take it out of the mouth, put it back in the patient's mouth, straight in, and then angle it to where you have the proper horizontal angulation, making sure that you have good vertical angulation, because again, if this was way up here by their eyeball, we're gonna have vertical angulation errors. And sometimes that's just not possible to do or to avoid. So if the patient had a very shallow palate, then you might end up getting some vertical angulation. But the idea behind a periapical is that we get the apex of the root, okay? So that's that for that one. And then now we're gonna move over to the patient's lower left. So one of the other things that's significant that I wanna show you guys is if you hold this like it's a teepee, so do you see how this looks like it's a teepee or the top of the house? What you're gonna do is, again, you're gonna dive in with the front edge of this, and then you're going to use another, like a crossover technique with your hands. So you'll notice when I'm holding this, I'm actually holding it like this between the ring. And then I'm gonna place it like a teepee, because when you go in like this, you wanna make sure that you're retracting with the cheek, your other finger, okay? So I place it in just like so. On the dexters, they're a little hard because they're stiff, so bear with me. So this one, I want to make sure that it's far enough forward to get the distal of the canine and the premolar, and then I'm going to have my patient bite down, okay? And then I would line up the ring like so. And then if I'm doing the molar on this side, I'm just going to push it back a little bit further and then have the patient bite down like so. Now, when I am ready to go ahead and do the patient's upper left and lower right, I'm actually going to show you guys how to do that. So I'm going to take this apart. So the big thing is you want to take this apart like this, and then you want to just flip this upside down, or right side up, I guess I should say. And then with this one, the same thing. You're going to go ahead and take your ring and you're going to flip it up. So then now, how do I check it? I check it by making sure that the hook goes inside of the patient's mouth. Because if I try it over here, do you see how the metal bar is going outside of the patient's mouth? The fish is going to spit it out. So we want to make sure the fish doesn't spit it out, so we use it on the correct side of the mouth. So the hook is going to go in, so that way we can hook the fish, okay? So with this, when you put the sensor on, you always want to make sure that the cord is coming out of the patient's mouth and that you've aligned it with the bottom of the bite block, okay? So now this is, oh, I actually put that on wrong. See, you always want to make sure that you're checking it with the patient's mouth. Okay, so now we're going to be able to go in on the patient's upper left. So again, you're going to go in directly in the center of the palate, and then you're just going to angle it up to your premolar to make sure that you have correct horizontal angulation, okay? And then if we're doing the molar, we want to just go back a little bit further and place it to where it's parallel, and then have the patient bite down like so. All right, then the last two x-rays that we're going to take for the FMX are going to be the lower right posterior PAs. So with this particular one, again, look at how I hold it like a teepee, okay? I'm going to dive in. Now, you notice that I've switched my hand now. So I'm actually holding it with my left hand, and I'm going to retract the cheek out with my right hand. I'm going to take this front edge or this front corner, and I'm going to dive it down in between the tongue and the teeth. Because if you just go straight in like so, that is going to be very difficult to get that off of the patient's tongue. When you do a posterior PA, you never want it to be sitting on top of the patient's tongue. So you're going to go in just like so, and then I'm going to retract the cheek out with this other finger. Seat this kind of down into the floor of the mouth. I'm going to move this cord so that way you guys can see. You want to make sure it's parallel. This is not parallel. This is not parallel, but this is parallel. Okay. So I've got it far enough forward to do my premolar. So I'm going to have the patient bite down. So that's what it would look like for your premolar lower right PA. And then the last one, of course, is going to be your mandibular molar PA like so. So you want to make sure you go back far enough and then seat it like this. Okay. All right. So that's pretty much how you would actually do all of your packet placements for your paralleling technique using the XCP for a complete full mouth series of radiographs on an adult patient.